The funds that we get from Cure, we use to look into the concept that diverticulitis, which is a relatively common disorder of the colon, in fact has a genetic component. Typically, this disease is thought of as a disease of old age, as a disease of inappropriate dietary intake, low fiber intake, for example. But we have found that there are families who have multiple members who have diverticulitis, and these members typically have their disease take place at a much earlier age, in their 40s or 50s, and not infrequently those patients will have a more severe form of the disease. What we frequently have in the clinical situation is a patient who may or may not need surgery because they've had a relatively mild attack of diverticulitis, and surgery, though an option, is considered something that may not be necessary because 3/4 of the time the diverticulitis can be managed with antibiotics and may never recur. So if there was some way we could do a genetic test, for example, that would predict the severity of someone's diverticulitis, that then would allow us to decide to do surgery at an earlier or safer time, we could potentially avoid these added problems of secondary surgery and the creation of a colostomy, which obviously is not to anyone's liking. Avoiding such complications is key, and if you could therefore operate on these patients at a time when they are otherwise healthy, in other words, do elective surgery as opposed to emergency surgery, the outcomes would be much better and would be associated with significant cost savings. We have now 5 families who have multiple individuals affected with diverticulitis. And so what we're basically planning to do is to do a complete genome analysis of those patients using the Cure funds, so that it's not just looking at 1 or 2 parts of the patient's physiology. It's actually looking at as much of the genome as we can in order to then find those parts that are relevant to the disease process. And so the Cure funds pays for that rather sophisticated analysis of their genome. No one else has ever really thought of diverticulitis as a genetic disease, and no one else has ever really thought about trying to analyze someone's genome to try to find factors that then can be used to treat these patients better.
The idea of the ALS Center actually came about around 20 years ago. The idea of the ALS Center at that time was to bring together a multidisciplinary team to help care for our patients. Over the years, that's evolved, and we've taken on a big research component to the center as well. So in addition to providing care, one of our main missions is to do both clinical research and to collaborate with basic scientists who are doing research on ALS. So the work we're doing with the Institute for Personalized Medicine really involves looking at the genetics behind ALS and asking the question, how big a role does that play, particularly in the individuals who we thought were sporadic and in whom we can't identify a family history and in whom we don't know the cause. People with ALS may present at an older or younger age. They may present with a rapidly progressive or a more slowly progressive course. They may present with symptoms beginning in their speech and swallowing or in an arm or leg. And we think that most likely the variation arises because there are many different causes. And if we could identify specifically the causes of ALS in a particular individual, that would really give us the tools to design better treatment, to customize the treatment or to personalize the treatment, so to speak. I think the reason behind the relatively modest gains that we've made in terms of treatment is really because we give the same drug to everybody with ALS. But we don't really know that that drug will be effective in everybody with the disease. It probably is more effective than 3 months by a considerable margin in some people, and probably ineffective in others. And if we can identify and target drugs to people based on the cause of the disease in them, that would really be the goal of what we're doing. The main thrust of the Cure funds is that it's been absolutely critical in permitting us to do a whole area of research that we've not engaged in before. So it's not been so much a particular piece of equipment or particular person as actually the development of an entire program